Hi, my name is Jonathan Clayton, and today I'll be going over effects of music therapy as an adjunct to chest physiotherapy in children with cystic fibrosis, a randomized controlled trial. Cystic fibrosis is a genetic disease causing digestive and respiratory disorder. Patients with CF may have increased mucus in their lungs, making it difficult to breathe properly. Airway clearance therapy, also known as ACT, is a required daily task that lessens symptoms and improves lung functionality. For children that are unable to perform ACT themselves, they are accompanied by their parents until they are capable of treatment alone. To maintain compliance with mandatory daily treatments, it is pivotal for patients and administrators of the therapy to perceive it positively. However, the task is often strenuous and physiologically taxing. Because the task is viewed negatively in most cases, music therapy may be practiced to help form a more positive relationship to the therapy. Methodology. Ages of 2 to 17 were picked for the clinical trial. Those picked were also under the care of Malaga Regional Hospital, which had approximately 80 individuals at the time with cystic fibrosis. The study monitored patients and the parents who administered ACT to their children positively in perception of time while performing the task. The study also tracked the frequency that patients looked for or chose other remedies to cope with airway clearance therapy outside of musical therapy. Patients were chosen in the pediatric pulmonology unit at Malaga Regional Hospital. Patients were required to understand the clinical trial. People who had hearing loss were not prescribed airway clearance treatment or waiting for or had a lung transplant. There were 3 different groups with altering task. The treated group, which listened to curated music, the placebo group, which listened to music they most liked while performing therapy, and the controlled group, which listened to no music during the clinical trial at all. The curated music selected for the treated group was music intended and composed specifically for children with cystic fibrosis. Conclusion and discussion. Results demonstrated that after a short period of time, there was no sign of significant change in preference between treated, placebo, and controlled group participants. Results after a 3-month time frame, however, demonstrated a significant change. Children that listened to the music specifically curated for them with CF saw the most extensive change in perceived time spent performing airway clearance treatment. Specifically curated music was the most effective at maintaining positivity in children and adults that were tested during the trial. Children that listened to music they preferred during therapy saw the second greatest increase in positivity with parents and children. Children that did not utilize music had the least amount of change from the beginning to the end of the trial in positivity, as well as perceived time between parents and children during airway clearance therapy. How to improve. One way the study could have been improved is by adding additional participants, since a sizable portion were unable to be surveyed for the study after the research had been carried out. Another variation in the study that could potentially be positive would be by having the clients take multiple surveys throughout the study instead of the one that they provided at the end. For my references, I did my research article from the Maricosta Library, and the other one I received from Google Scholar. Thank you, and that concludes my presentation.